Opposition-held northwest Syria is, according to doctors, at the start of its second COVID-19 wave. Not that you would know that to look in the streets, where social distancing doesn't seem to exist, and masks are barely visible. Compliance with public health recommendations has been one of the biggest challenges here. A bombed-out region whose population is mostly the displaced, too accustomed to trying to outrun death to take an invisible threat seriously.
This is Carleton Hospital. It was affected by airstrike.
And that light at the end of the tunnel, that relief that vaccination is meant to provide, it's petering out.
Of course, the situation in India regarding COVID will affect all the world, as India is the biggest source of vaccine in the world.
And is the source of the AstraZeneca vaccine that just arrived here. Dr. Yasser Najib, an infectious disease specialist in Idlib, heads out to oversee the rollout of the initial doses. This first batch is only enough for around 1% of the total population here to get the 2-dose regimen.
What happened in India, unfortunately, maybe make doubt about the program of offering the vaccine to the countries in need. We hope the next shipment will not be delayed.
In all likelihood, it will be. These vaccines were provided by COVAX, a global initiative to mitigate against vaccine inequality that sources, or rather was sourcing, most of its vaccines to be distributed to low-income countries from India, home to the world's biggest vaccine manufacturer, the Serum Institute of India. The COVAX initiative was already struggling to provide for some of the most vulnerable, as richer nations hoard limited vaccine supplies. With India now crushed by its own rampant, devastating COVID-19 crisis, vaccine exports from there have, understandably, now ground to a halt. So where does that leave war-torn places like this, and other people in need of protection?
Each country wants to offer the vaccine for their own population, and the poor countries, unfortunately, will receive the vaccine, but with delay. And this will make the number of cases and deaths will be increased.
And so, for now, they make do with what they have. There is no other choice.